Okay, we're going to look at the hip now. We're going to look at active movements of the hip. Are you okay, Jen? Are you okay if I put my hands on you, get to move? You happy with that? Okay. Right, Jen, first of all, I want you to look at your hip flexion. Right, so would you mind just, that's it, bend your knee, bend your hip, lift it right up towards your chest, okay, and down. Any problems with that at all? Okay, so that's hip flexion. Now, what I want you to do is I'm going to support your leg, okay, and I just want you to bring it out to the side for me, okay, as far as you can. I've got your leg and back. So that's hip abduction, okay. To look at adduction, Jen, I'm just going to ask you to bring this leg over here, and can you bring this leg across the midline? And that's adduction, hip adduction. Okay, now we're going to look at hip rotation. And what I want Jen to do is, Jen, do you mind rolling onto your front for me? Okay, and then what if you bend your knees, if you're comfortable, you alright? And then just let your feet fall out. Okay, that's internal rotation of the hip and back, and then can we look at the other way? Yeah, and we can cross again, and that's lateral rotation of the hip and down. Thanks, Jen. And then while we're in that position, do you mind moving to standing up? Are you okay? Can you manage? It's not too high for you there, is it? And can you stand up and face me?
Yep.
Okay, and with the same hip, because we're just looking at one side really, can you bring your hip back? That's it. That's it. And try and keep your body up. That's it. Okay, so those are active movements of the hip. Do you want to have a lie down again for me, Jen? Okay, we're now going to look at passive movements of the hip. Are you okay if I put my hands on and move? Yeah. Okay, we do both sides, but for this example, we're just going to look at one side. So this is hip flexion. Bring your hip up, Jen. Now I'm just going to feel the overpressure there. Again, supporting. Okay. Again, if you want to, you can put your hand underneath. Again, so you're not on top of the knee. Just so you're not pushing with this hand, you're pushing with this hand, and you're pushing down and relax. Okay, so that's passive hip flexion. We're going to look at passive abduction of the hip. Okay, Jen, you all right? I'm going to support your knee here, support above the ankle and under the knee, and we're just going to come out to the side. Are you all right with that? So we'll come out, and then nice and move, and just feel the end range there. Okay? Down. To do adduction, is that all right? Okay, we're just going to again support the leg, just bring it across. All right, any problems with that?
No.
Good. Okay. So that was AB and AD adduction of the hip. We're now going to look at rotation. Just going to bend the knee. Okay. Again, supporting Jen's leg so she's nice and relaxed. Okay. Supporting above the knee, and what we're going to do is we're going to do internal rotation of the hip by just bringing the leg out, okay? Yeah. And then we'll swap our hands over, okay, supporting the knee, and we're going to do lateral rotation or external rotation of the hip. Okay, and we're going to go down. To do extension, Jen, would you mind lying on your side for me, please? Yeah. Okay. Your leg there. So you bend that leg, make sure you're nice and supported. You all right there?
Yeah, I'm fine, thank you.
Yeah, I'm just going to have your leg there. Support the knee. Slight abduction, not too much there though. Put your hand on just above the greater trochanter there, and you're just going to come back. Stabilising with your left hand. And bring your knee back. Is that all right, Jen?
Yeah, fine.
Okay, looking at passive extension of the hip. Thanks, Jen. Thank you. Do you mind rolling onto your back? How are you feeling? Okay?
Fine.
Right, we're going to finish now. We're going to look at resisted movements of the hip. Okay? So can you bring your leg up for me, Jen? And keep it there for me.
Yeah.
I'm going to try and push down, okay, towards your feet. I want you to resist. Okay, that's resisted hip flexion. Okay, now then, we're going to look at hip abduction and adduction. Okay, so for AB, abduction, we're going to put a hand on the outside of the legs there. And Jen, I just want you to push against my hand and relax. Okay, again, you might need to think about your position in here depending on the size of the person. Again, we're going to look at adduction now. I'm just going to put your hands on the inside of the knees and ask Jen to push in and relax. Okay, so that's adduction. Okay, to finish with, again, supporting the leg, supporting the knee, we're going to look at rotation. So it's the same handling as you were doing for your passive, just supporting the top of the knee, okay there. What I want you to do, Jen, is just bring your heel in towards the middle, if you can do that for me. Okay, and relax, all right? Yeah, does that feel okay? Okay, I'm going to support you here, support the foot, and I want you to you need to make sure that you keep that femur in that position, all right? And can you just put your foot out against me there and relax? Okay, down. So that was resisted medial and lateral rotation of the hip. And if you just come onto your side again for me, and if you straighten, that's it, lovely. That's it, bend that knee, and I'm just going to support your leg again, Jen, okay? But I just want you to push back against this hand here, okay, that's on your thigh, and push. Okay, and relax. You've got to think about your position, because if they're strong, okay, and again, Jen, push and relax. Okay. And that was resisted movements of the hip. Okay? Thank you.